Welcome to the Future of Dermatology podcast. I'm Dr. Farah Kamangar. What you're about to hear is a standout session from this year's SF Derm Conference in Napa, where leading voices in our field gathered to explore what's next for dermatology.
These are truncated replays from our original recorded sessions. Join us in September of 2026 to get the full impact of the SF Derm experience.
Okay, I'm going to move on to my next topic here, which is start off with this patient, 48-year-old woman who comes in just in desperation. And I'm shedding, my hair is thinning, I can see my scalp, my texture's not the same, it's breaking. She's just, at the end of it, she's like, you know what, this is just not my hair. She literally said this. I think all of you in the audience have probably had patients who have come in with the same kind of extreme reaction of, the sky is falling, what's happening with my hair? And she may be saying, searching the internet, is it genetic? Is it hormones? Is it the environment? Am I just aging? Is it something that I'm eating? And I like to label this the midlife hair crisis because it truly is one. And the answer is probably yes, all of the above. And that's why it's so important to think of this as a holistic picture and think about our treatment options for this patient as well. But before we talk more detail about this patient, what we might do for her, I wanted to kind of take a bird's eye view of the issue. It's astounding if you look at the numbers. 75 million women are experiencing perimenopause, menopause, or post-menopause. There are a lot of those individual patients out there who are seeking care, who have issues with their hair. Most people think of menopause as a decline in the estrogen level to the point where over 12 months you have not had a period. That's an event. That's a single point of menopause. But it's really truly a transition period. And it's important to think of that as a transitional period. If you look at just a snapshot, a 6-month snapshot during perimenopause, and you look at the hormonal fluctuation, it is stunning. It's really, there's a lot happening there with those hormones. And it's no wonder that women come in and say, this is not my hair. I put that photo in for Vale Reese for the art, but he's not here. But that's what women are feeling. And there's a reason why when we look at those fluctuations in hormones. But it turns out that there's truly been a big gap in our research when it comes to those effects on the hair follicle. And it's probably because it's a very complex issue to study and to understand. We do know that the hair follicle, much like the skin, is an estrogen-dependent target tissue. There are both estrogen receptor beta and estrogen receptor alpha on the hair follicle. So we know that it's affected by the hair follicle. We did a study looking at women pre and post menopause, just grossly looking at those numbers, at hair diameter, hair cycle, hair density does change pre and post menopause. But really, how do you study this further? How do you think of this conceptually? And one way to think about it is, and I was looking at Dan's overlapping circles. I'm thinking of the same overlapping circles, and I think of it almost like a symphony. So you've got the orchestra playing this beautiful music when everything is happening optimally. So optimal follicular function. You've got your genetics, you've got your hormones, you've got your immune system, environment, all singing together, making music together. Everything's going just right. But what happens when you end up with this concept that we call female pattern hair loss? At its core, it's really it's follicular sebaceous dysfunction. And it may be that there's been some miniaturization going along, but you're still making music. You've got some hair fiber changes as the hair grays or as the hair becomes drier, or a little bit of breakage, but you're still making music. You've got this low-grade inflammation and changes in the immune system, but you're still hanging in. And maybe it's just once those hormonal changes hit that's the last straw to some extent. That's when the music starts sounding different. Wait, that doesn't sound the same. This is not my hair. So you have all of these things happening in concert during that midlife hair crisis. Well, how do we treat that? how do we take this approach and then turn it into a treatment approach? And it's really important to think of this not as taking a single approach. You can't just tackle one component. You have to look at it holistically. You have to address all the concerns. Otherwise, patient will come back and say, well, what about this? Well, what about that? I heard about this. And that's why they're getting all of that input. It's important for you to kind of provide that wraparound treatment approach. So you want to reverse the miniaturization, stabilize the hair cycle, decrease the inflammation. Talk to them about gentle hair care. Take this opportunity to talk about healthy lifestyle practices, obesity, those adipose tissues that also secrete estrogen, maybe flipping things around as well. So take a moment, talk about all those. And here I just listed all the various tools in my tool basket to reverse miniaturization. I use a lot of minoxidil, 5-alpha reductase inhibitors. I should probably have added spironolactone in as well. I realize it's not there. PRP, low-level laser light. I think of those as foundational. Sorry, I'm running out of time already. Stabilize the hair cycle, minoxidil, melatonin, sleep hygiene. Think about decreasing inflammation with corticosteroids, sometimes anti-dandruff shampoos, gentle hair care, and healthy lifestyle. You'll see that I did not include anything about estrogen, hormone replacement, because there is currently no data to support the use of these medications for hair cycle stabilization or hair growth. And it's probably because it's so complicated. That halo effect that your endogenous estrogen brings to the table just can't be replicated. You can't take the backup musician and bring it in and expect the same sound. So there's many different types of estrogen: estradiol, estrone, estriol. How much of each do you need? What's the dose? What's the timing? What's the frequency? That's probably why we haven't hit on an appropriate replacement. So here's our patient who came in saying, this is not my hair. This is after 6 months of being on a good regimen of treatment to reverse the miniaturization. We start adding in some of those other hair care advice and improving your nutrition lifestyle. And you can see here that she's feeling much better about how her hair is doing. Farah, am I okay with just going a little bit longer? Okay. This is the other component of patients with, again, thinking about the changes that occur during menopause. This is a 43-year-old woman with loss of eyebrows, alopecia at the hairline, and at the part. And I've included some arrows because it's impressive to see where her hairline used to be. You can't really see it, but there's a lonely hair there. So this is where her hairline used to be. Hair's moved back, and she's got this funny part here. Turns out she was a swimmer who was putting sunscreen on her face like this, and then right here in the middle. And once she stopped sunscreen, the inflammation, the progression of hair loss was reversed, and we reported this. So frontal fibrosing alopecia, again, let's think about it conceptually of when the orchestra is playing beautiful music, it's symphony music, that's wonderful, but when things start going awry, what can happen? In frontal fibrosing, you still have, again, those hormonal changes, are they impacting the sebaceous gland, the immune system? There's collapse of the immune privilege. And in terms of genetics, there may be some susceptibility genes that are specific for patients who develop FFA. Environment, though, here is really important to avoid that toxic buildup in the sebaceous glands that may be triggering a lot of this inflammation and collapse. And this is a one component that is modifiable. So I've really been harping on this with my patients. Eliminate chemical sunscreens, eliminate any micronized nano sunscreens or powders, eliminate fragrances. And when you eliminate this, you can end up really making a big difference. So I won't, because of time, get into all the details of my FFA treatment approach, but I can tell you that this patient had tried a lot of different things. I was still struggling. And then we finally identified that in her moisturizer, she still had a chemical sunscreen. We eliminated that and finally ended up with good response. I have two other patients here. She came in, was already on a good regimen with her FFA, but when you look on dermoscopy, there was still a little bit of erythema and scaling. Just eliminating those environmental factors, clinically, she looks about the same, but wait till you see the dermoscopy. Super impressive. These are the kinds of changes that I'm seeing, and patients are really, it's making a big impact. So getting rid of all those products. The patient with LPP, same story, incredibly inflamed. I call that the Sephora sign. She said her bathroom looked like a Sephora. She had so many products that she used. Get rid of them. And you can see that she clinically looked better. And again, look at the dermoscopy. Super impressive how much better she is.
Thanks for joining us today on the Future of Dermatology podcast. If you enjoyed learning about the science behind skin, make sure to subscribe, and we'll see you next time. As a reminder, this podcast is for educational purposes only, not for medical advice. Always consult your healthcare provider.